You're listening to episode 51 of the Fed and Fearless podcast. On this episode, I'm speaking with Mariette Abrahams about how personalized nutrition can help dietitians improve their clients' health outcomes and use technology to make diet and lifestyle changes easier and more effective. So stay tuned. Hi, I'm Laura Schoenfeld. I'm a registered dietitian and coach trained in functional medicine with a passion for helping women just like you ditch perfectionism and use food, fitness, and self-care to fuel your bigger God-given purpose. I believe that it's possible to achieve your biggest life-changing goals without the frustration, obsession, or negative self-talk that so many women subject themselves to every day. All you need are the right tools, the right mindset, and the faith to turn your dreams into reality. I'm here to guide you along the way. The truth is that you are so much more than a body, and I'm on a mission to help you change the way you think and act at a core beliefs level so you can transform your physical, mental, and spiritual health from the inside out. Are you ready to become fed and fearless in your pursuit of a healthy, meaningful life? Welcome to the Fed and Fearless podcast. Hey everyone, welcome back to the Fed and Fearless podcast. I'm Laura Schoenfeld. I'm your host as always, and we have a really interesting episode for you today all about personalized nutrition and using technology in a way to help us all get healthier. I'm super excited to have with me on the show Mariette Abrahams. She's a registered dietitian with a PhD and an MBA, and she's the CEO of Kina, a boutique consultancy whose mission is to bridge the gap between academia, research, industry, and frontline health professionals. As someone who has always created new services, challenged the status quo, and tread where no one has gone before, Mariette combined her nutrition and business training to create her own role in the personalized nutrition and wellness industry and has never looked back. Now she is passionate about focusing on prevention and helping individuals to improve their health through data and knowledge. Mariette and I talk about some really interesting topics that apply to both dietitians and business owners as well as the consumer. It's really interesting to me to learn about how the different technologies that exist, not only including things like DNA technologies, but also things like cell phone technologies and data technology, all of that can be used to improve our health. And I know sometimes it's easy to think that technology is actually harming our health. And to be fair, it is in a lot of ways. We do need to be mindful of our technology use. But Mariette and I talk about how we can actually leverage the technology that exists in a way that can help us all reach our health goals in a more effective and personalized way, which again is something that I think a lot of us dietitians like to do for our clients as much as possible. But when we find out that there are technology services that we can use to make that even easier for our clients and to really scale our ability to help people, it's really exciting to know about the technology that exists and the way that we can do that for our business and then for ourselves as consumers. So I'm super excited to introduce you to Mariette. She is very knowledgeable about this topic and has a lot of wisdom to share. And so without further ado, here is Mariette Abrahams.
All right, welcome back, everybody. I am so excited to have with me here today, Dr. Mariette Abrahams. How are you doing today, Mariette?
Thank you. I'm doing great. Thanks for having me.
Yeah, so I think I'm trying to remember how we connected because I feel like we had connected talking about some of the research that you were doing in the business that you run. So I would love to hear a little bit from you about your story and about how you got started with your entrepreneurial career in personalized nutrition and running your own business.
Yeah, so I have been a dietitian for just over 20 years now, so I don't know where the time has gone, but it's really kind of just flown by. And I originally started in the clinical setting, and I specialized in nutrition support and gastroenterology, and that was really my passion, my love. I fell into managing inflammatory bowel disease patients, so that was really my passion. I really was very interested in that area, doing the whole, liquid diets and, following patients up. And that was really interesting. But of course, at that stage, genetics was kind of mentioned as a vague topic, that there may be kind of some kind of role of genetics. And I actually left my clinical role after 7 years in a hospital setting. And then I joined a food company in medical nutrition, scientific affairs. And that's really where the genetic component, really the research started coming out a little bit, but it was within the area of kind of the impact of diet and on IBD patients. And that really sparked my interest in nutrigenetics, because it was kind of like, okay, well, do some patients do better on liquid diet? Do some patients do worse on liquid diet? Why do some people need surgery and others do not? And that really sparked it. So actually my role in the food company, or the medical nutrition company, was I was responsible for the liquid diet. And so that really just sparked my interest even more. And I got, far more involved in the research as well. And then I moved out here to Portugal, where I set up my own consultancy. It was kind of private practice, and then it became consultancy. And I decided, this is it. This personalized nutrition area and technology. While I was actually at the hospital, I finished an MBA. And so I did some, managing the dietetic department as well. And I thought this is the perfect time to blend nutrition with business and technology. And that all kicked off the entrepreneurial journey.
That's awesome. And I know you have a PhD as well, so you have a lot of degrees.
Yeah. I mean, the PhD was also, it was interesting, and it had to do with timing, because of course, back in 2008, I would say, personalized nutrition was nothing. It was, it didn't really exist at all. And so it really started off very slowly. And I thought, well, while this industry is kind of growing and the research is going to take some time, might as well do a PhD, And so my PhD was really focused on what are the determinants of dietitians adopting new personalized nutrition technologies into their practice. So it's really looking at the next generation of, education and practice, and what is it that we need to look at to integrate into the curriculum, and that we need to teach to help the integration, because it's not just about the tech, it's also about the mindset. And that's where entrepreneurship really, really stood out as a key factor.
That's awesome. I love how you're able to combine all the different angles between the research and the practical component with dietetics, and then the entrepreneurial component with your MBA. So for those who aren't familiar, how do you define personalized nutrition?
Yeah, I'll give you the formal definition of personalized nutrition that actually came out earlier this year. We said personalized nutrition uses individual-specific information founded in evidence-based science to promote dietary behavior change that may result in measurable health benefits. And I think this is quite a good definition, but we have to also remember that in terms of the benefits, this can be, health outcomes, but it can also be behavioral. So we don't always have to have, because it depends on the individual's perception of what it is that they want to achieve and how they want to, improve their own health. And so I really believe that, there is a combination, but it needs to be grounded in the evidence base.
And how do you compare the concept of personalized nutrition to, I guess, and I know that the dietetics education has been changing over the last couple of, years or decades, but how would you compare what you do in that field to what dietitians are typically learning in the traditional education?
Yeah, that's a great question, because when I studied, when I was doing my degree, it was very much sickness driven, very much illness driven, and learn how to manage conditions and work in community and work in food service. No technology was, we had floppy drives, at the universities. If anybody of your listeners still remember those. So it's really that far back. And now we are at a stage like 20 years later where genetics is not even integrated into the curriculum. So if we really, really are very honest, things have changed, but they haven't changed at the pace that technology has changed. And so there is a complete divide in terms of what it is that we are learning and what is really happening in the marketplace. And so for some, I think there's this perception that, technology and genomics, this is 20 years away. And people have told me this, and they married, like, it's 20 years away. I'm not going to be worried about it. People say there's no evidence and therefore I'm not going to learn. And now we're at a stage where people are falling around saying, people are coming in with their reports. I don't know what to say. And, just saying the line of, there's no evidence. People don't want to hear that. They want to hear a long, detailed explanation about the yay or the nay. And I think that's where there's a difference. So in practice, and this is around the globe, the education or the curriculums have not kept up with what is really required in a modern day preventative and personalized and participatory healthcare system.
Mm-hmm. And I think it's interesting you said that, because I know, and this doesn't happen to me quite as much, but I know I've had a lot of clients who get these reports from a variety of services. And a lot of times, like you said, they don't know what they're supposed to do with them. They don't know if it's accurate. And like you said, a lot of us dietitians, maybe we're not familiar with the particular company that they used or the official policy from like the Academy of Nutrition and Dietetics is that these are not evidence-based. So it gets a little bit tricky because, again, like you said, there is a lot of movement that's happening in the technological space. And that's one thing about entrepreneurship that I particularly like, is that it's always thinking about what can we do better, as opposed to thinking like we need to stay with the way things are done. But it's interesting when, as a dietitian working with clients, you want to stay on top of new technology, new things that are available. But then there is so much of this shady, like, is this really accurate, or is this kind of just like a marketing thing? So it can get really tricky as a clinician. And then as a consumer, if you have a provider that you're working with and they say there's no evidence, then you have to think, well, is this just total nonsense, or is there some value here to what I just did? So I can see how it can get really frustrating for a lot of people. And I feel like that leads us to the next question, which is, what are some of the myths that you'd like to dispel when it comes to personalized nutrition?
Yeah, I think because personalized nutrition, I like to call it tech-enabled personalized nutrition, because we've been doing personalized nutrition all along, But when the new thing is the technology is the new factor that's been brought in. And I think because nutrigenetics was kind of the first thing on the market, people think of personalized nutrition, well, it's just DNA. And it's not. Because as practitioners, we kind of take all these different, lifestyle factors or cultural factors or religious factors into consideration, which is personalization. But now we also need to think about, well, what are the, social determinants that we also need to include in that? What does the individual want to achieve? What is their literacy level, not only in terms of food and health and nutrition, but also digital? And I think, so in terms of just considering personalized nutrition as it's just DNA based, it's just not true. Because what we want to do is improve health outcomes, improve, behavior, but that is enabled through technology.
Mm-hmm. So it's not just about looking at somebody's genetic information and saying, you shouldn't eat, too much saturated fat because you have this gene. It's also about how do we use technology to actually help people implement changes. Correct. Because, we can do so much also with nudging, if you think of how can we better communicate with individuals now that we have the technology. Some people want, face-to-face, others just want to chat, others just want to receive email. That in itself is personalization. So we shouldn't just think about, this tech-enabled personalization just as DNA. And the other thing also, I think, is that there is a perception that it's expensive because you need a test. And that's also not true, because there are a lot of apps that can help us to, shop better, and it can provide you with swaps, healthier swaps if that's what you want. If you want to reduce your sugar intake, if you want to increase your fiber intake, and these apps are actually, a lot of them are available for free as well. So we shouldn't just think personalization, you have to have a test. We also need to think of the kind of lower level components where we can help people just to improve their lifestyle or the choices that they make that is enabled by these masses of, data that we now can interrogate and help people to make those choices. And kind of
digitize the information that is out there and to make it really tangible in chunk-sized bits.
Mm-hmm. Yeah, I imagine if companies like Facebook and Instagram can keep us attached to our phones and paying attention, that we can do that for health improvement goals as well.
Absolutely. And I think the other myth was this whole concept of it's really far away because it's not far away. It's already here, but it's evolving. And I think, the research now that happened, that started like 6, 7, 8 years ago, now we are starting to see more and more of the literature kind of validating this approach that yes, actually people do change their behavior. They can adopt a healthier diet if they get the right information kind of in the right format at the right time that is enabled through technology, and they don't have to come into a clinic to see someone, they don't have to have an expensive test to have it personalized. And so I think that's definitely, the key things that we need to remember.
Mm-hmm. And this is a little bit of a tangent, but have you seen any changes with the willingness to use these technologies with all of the stuff happening with COVID?
The interest, we know that from Google searches, for example, that the interest in terms of searching for foods with health benefits, for example, has soared. So people are not only looking online for people who talk about health and nutrition, and, whether it's immune boosting. I mean, I know we all think it's overblown a bit because you just don't boost your immune system like that. But I think it's important to remember that people are accessing information and searching for credible information online, and they are looking at who to follow in terms of where to get that information. What are the experts saying? What are the influencers saying? And who should they believe? And so there's definitely not only a surge in interest in terms of telehealth in accessing healthcare, but also in terms of what can they do proactively to find that credible pieces of information.
Mm-hmm. Yeah, it's interesting having been in an online business myself for almost 7 years now. I feel like when I first started, and I told my advisor, I guess at the time, what I wanted to do, right out of grad school, start my own business and do like virtual, like online business. And they looked at me like, I don't know if that's a good idea. Like it just was not something that most of the students were even thinking about, let alone like ready to do when they graduated. So when I first graduated, it was very much like kind of an odd career path to take. And now it seems like, especially with COVID, I'm seeing this year, a lot of dietitians who were used to kind of more of the traditional face-to-face, in-person kind of experience, they got forced to move online because of the quarantine stuff. So now that people are starting to use online, even just like you said, like the telehealth video visits, that I almost feel like has unlocked the interest in how else can we use like the internet and apps and stuff like that to connect with our clients and our patients.
Absolutely. And I think, and this is also going back to the PhD again, this is what was needed to jolt it into, digital health adoption. But it also means that now there's this realization that actually just my clinical knowledge is not enough. It's not enough. You now need to learn how to use the platforms. You now need to know how to, book appointments, take payment, market, keep in contact, all these different aspects that seem so remote from what you've actually learned. They are here to stay. It's not just, for this year. It's here to stay. And so I think we definitely, need to support each other a lot more. For those especially who've come, started a lot earlier. I mean, you're great starting so early. I certainly wasn't ready. But I do think that digital is the way to go. And I think, and we'll talk about it at the end, but in terms of this digital nutrition mindset, this is what people need to adopt. So it's not just changing things from what you did in the clinic to now an online portal. You need to reevaluate and revamp the way you deliver care. That's essentially what it is about.
Yeah. Well, I'm really glad you're saying this because I, this year, launched a group coaching program. I'd been doing business coaching for other dietitians since last year. And this year, with all the COVID stuff, it kind of just fell in my lap to do a group program. And so one of the things I teach my nutrition business owner clients is how to do things like marketing, how to package the way that they work with their clients into a system that can be both done face-to-face as well as to have some virtual components where, they can teach their clients virtually. They can create handouts and actual tools, digital virtual tools that their clients can use to implement what they're recommending. So it's interesting that you said that, because I do think I don't say a lot of pushback. I think it's a little bit of a rude awakening that some of my business coaching clients have had to go through to realize just having your dietetics degree at this point, if you want to have your own business, is not enough. You have to know how to communicate. You have to know how to connect with people online and using the technology that exists. And, and it can be a little frustrating because we put a lot of work into our degrees. To get a dietetics degree, there's a lot that goes into it. And you want to feel like that's all I needed to have an online business, but it's definitely not. And I think this year, like you said, it just kind of catapulted the need to be able to understand marketing, communications. And again, it's not being like a sleazy salesperson. It's how do you communicate even with behavior change? How do you communicate with a client to help them make those changes and not just give them a handout with 50 bullet points on it of what they're supposed to do?
Absolutely. And this is another very important point, in that I think there's been this wave of, let's create a program of your 6 weeks to whatever, improve your skin, or, and I think we see this with Netflix, with, whatever, the Amazon. People want personalized healthcare too. And a 12-week program is great because you can get a group together, or, but when it comes to healthcare, people want personalized healthcare as well. So the same diabetes prevention program that is running may be great for you, but not be great for the other person. It may, motivate some, but it might not, motivate you in the long term. And I think this is the other new concept, or new dimension that we need to think about is, okay, I have my nutrition program or a signature program, but how do I then further personalize it, driven by data, to then, make sure that this information sticks and I'm communicating in the right way so the message actually comes across. And I think that's another thing that we definitely need to learn as well.
Yeah. And that's honestly one of the hardest parts about creating an online program that a group runs through, is being able to create something that can work for multiple types of people, even just different learning styles, right? So if somebody's more of an auditory learner versus a kinesthetic learner, the types of learning materials need to be appropriate for those types of learners. So it is a challenge, but I think if someone can do a really great job of meeting that challenge, then their program is going to be a lot more successful and they'll get much better results for their clients.
Absolutely. The industry, has exploded, with like you say, it's difficult to keep up with everything that's available on the market right now. And I think a lot of the practitioners are kind of like, oh, well, what do you use? And it's kind of by, just by mentioning a recommendation without looking at the bigger picture. And the research has really shown that, in terms of nutrition, we really use technology to keep a record, like electronic health record, or for nutrition analysis, or for, keeping a food diary. Nothing is really being used for behavior change. And so being able to understand, okay, this might work for this person, but it might not work for this kind of a person, is really a new skill that, practitioners will need to learn to know what would match for the ideal client, I would say.
Mm-hmm. Do you have some examples of other types of technology that are being used currently that someone who's working with clients either virtually one-on-one or creating these online group programs that they could be looking into?
Yeah, I'll give you some examples. I think one that I like, or that I know of, is Eatler, for example, which I know is quite popular. And I think this really brings personalized nutrition to a newer level, because as a consumer, you can access and then just say, okay, well, I want to improve my eating or just have kind of a meal plan. I don't think anybody in their right mind cooks a new recipe every day. But I do think having an idea of like a meal plan or the kind of foods that I like, that gives you a good baseline of, these are the meals, these are the foods, and here's my kind of shopping list. But then once you get into the medical nutrition side, I think many companies can take it for granted that, oh, well, you just say this or you just do that. And it's not so easy, because you have to think of all the different factors, the medication or the lifestyle or, the family setup. And I think that's where having that kind of next level up of the access to medical nutrition with, the access to a dietitian, for example, with the meal plans and the personalization, that is an ideal way to step it up. So you have the interaction part where some people who don't want the dietitian don't have to have the dietitian, but if you want more complex, you actually need a level of education and information at the same time as well, and actionability, so that it fits into your day-to-day. So I think that is kind of a great example where it's moved up, and that's in terms of food. But what I also see is some of the companies now, there's a movement from just thinking of, well, only my test is great and therefore, it's the only thing that you need. It's just not true either, because, we want to see how you respond as an individual to what I'm telling you. And so we see more of the partnerships now coming together and say, okay, well, maybe we need to see how your lifestyle is and what you're eating and what kind of behavior, the barriers are there or the challenges are there, and which goals do you really want to meet, which might be completely different from what a healthcare professional thinks, but that's what they want to achieve. So I think it's now a mix of, it's moving from a just one-dimensional, use mine and that's it, to, okay, let's mix and match and see what works best for the individual and collect the data, going along.
Yeah, well, it's funny you mentioned the Eat Love app. I don't currently use that, but I remember when I first started with both one-on-one nutrition coaching and consulting. And then I was also working for someone named Chris Kresser, helping him create some of the online programs that they were offering. And I'm laughing because I almost feel like I blacked this out of my memory. I remember Googling recipes, like looking for recipes and then customizing them for my clients. And then in those group programs that we did, we actually manually put shopping list together with the recipes that were being developed. So it's just kind of funny to think back. This was, 7 years ago. It wasn't anything, maybe even less. It could have been like between 5 and 7 years ago that we were doing this stuff. And it's just kind of amazing that those would take hours and hours to put together. And that's assuming you were just Googling recipes. I also have hired recipe developers in the past to create recipes for my programs and that kind of thing. So it's just kind of wild to see now you have this program that can just spit out a customized meal plan for you and it's ready to go.
Absolutely. And I think this is where we need to see the potential in that, we can become more efficient, we can become more effective, but we can't compete with the technology. We need to be able to work alongside it because, whether it comes to the coaching or the behavior change, but you can focus on the quality of the relationships that you have rather than thinking, okay, well I don't want, because I need my piece of paper or, to print out my food list. Or I really think that's where the opportunity also is. And also to identify like hidden patterns and trends that, in our, whether it's the program clients or, practice clients that we maybe not would have picked up before. But all of a sudden, there's a trend and there's a new program that comes up, So I think, yes, definitely things have changed, dramatically. And I know I don't know anybody who loves doing meal plans.
I'm sure they exist, but most of my business coaching clients hate making meal plans. So having something like Eat Love or whatever, I know there's other companies out there, but just having a service that can do that automatically using technology, I think is really awesome. And it's, like I said, kind of funny to think back that I was like literally Googling recipes to put a meal plan together for somebody. And the worst part about that was that I had to charge for my time to do that. So, if I had to take an hour to create a meal plan, the amount of money somebody would have to pay to get a really simple meal plan made by me versus if I had something like Eat Love to just like pump out a meal plan, and maybe I just review it to make sure it's appropriate, maybe takes 10 minutes or something. So it being able to use that technology makes things a lot more affordable for people as well.
Absolutely.
Because I'm all about dietitians getting paid what they deserve. So I don't want someone spending an hour making a meal plan and charging like $30 for it or something like that.
Yeah. And I think, some of the other research that has also come out, I think it was here in Europe, where they showed that, the average family eats 5 meals like in a month. That's it. They just recycle.
Different ones?
Recycle, add different veg or here and there, but it's 5, meals. I mean, if you think about it, the time you spend, doing meal plans the first maybe week you're all motivated and gung ho, but week 5, you're going to go back to your, traditional. We also have in our family, we have a generalized Monday's veggie day, Tuesday's fish day, Wednesday, but it doesn't really change. We don't radically change our eating habits that widely. And so you can really work more, focus more on those, healthy behavior changes rather than just because it's those small nudges that have the long-term impact, and it's the longevity of it that has the big impact.
Mm-hmm. And speaking of those behaviors, how can technology help individuals to change their behavior?
Yeah, I mean, at the moment, what it's shown that for people who adopt technologies or get advice, personalized advice in very small chunks, it can help them to, for example, increase their fiber intake or increase the amount of, fruit and veg that they are eating, or reducing the amount of saturated fat that they're having. And so it helps with behavior change, but giving just it, because it doesn't give a long list of, right, this is what you need to do, and I'll see you in 8 weeks. It kind of says, well, for tomorrow, why not consider this instead of what you had last Friday, and then it won't say anything for another week. And in that way, people can actually start thinking about it, perfecting how they prepare it, get actually ready to have it, in the fridge or on the shelf. And that's, I think, the way, because the way that the relationship works now in terms of healthcare, and this is definitely post-COVID, is that we are not going to get people to come only when they are sick. People are going to come earlier and earlier and earlier, because now they're going to start thinking, well, actually, I want to prevent and keep my family healthy in the longer term. So this relationship of just helping people to reduce the saturated fat intake or reduce the salt intake is going to change completely. And we're going to have these annual health checkups, annual nutrition checkups, people are going to come back constantly. And so bombarding people in my, package of 2 visits and 1 live and 8 weeks is really going to fly out the window. I think what we'll see is helping people to change very small steps, very small things, but for the longer term, and not placing, people should take on the responsibility. So self-care will become way more important, but we need to meet people where they are and how ready they are to make the one change. If it takes them 6 months, then that's fine. It's not about what we think, it's about this, combined thing. And that's where I think technology can help in terms of behavior change.
Mm-hmm. Yeah, you're reminding me again of some of the big mistakes I made when I first started working in my business, where I would send, after the first appointment, I would send a 3-page packet of, here's the diet recommendations, here's the exercise, here's the sleep, here's the stress. And I thought I was being super helpful. Like, look at all these great recommendations. And I mean, to be fair, when you take private pay clients, a lot of times they are more motivated because, they're paying for it, right? So they want to take action. But at the end of the day, we're all still humans, and humans do not make radical, massive changes to their lifestyle usually. I mean, there's sometimes, right? Sometimes that happens, but normally we take time to make these changes. And I think it's cool to imagine, how could we use technology, especially as a business owner in our own business? Like, yeah, maybe you come up with the changes that you'd like them to make, but if there's a way to drip it out over time, that would be a really cool thing to have as part of a business model.
And I also think, there are newer technologies that are coming out that are not focusing so much on the how bad is your diet or how many calories are you eating? We are moving away from that to looking at what is the quality of the diet. And so looking at, okay, what can we change? So whether it's image-based logging or whether it's looking at sending you a picture of an apple at 4:00 in the afternoon, or gamification, playing games and, tapping. I saw one app which is really cool, which you tap every time there's a healthy picture coming up. And so you rewire your brain. And so I think there are newer ways of helping people to adopt healthy behaviors. But I think this really requires the collaboration of us as nutrition experts, together with the gamification people, together with the computer technology people, together with, everybody needs to collaborate and say, actually, this is the kind of struggles the clients are having, and therefore what new solutions can we come up with, because we know that from tracking, people can come obsessed with, the amount of calories, and people say, oh, well, I didn't have a snack, should I have a snack because there's a gap, there's an empty space in my diary. And so I think we are moving away from that to a more holistic view in terms of what does health really mean? How can we move people to well-being and wellness, and how to make, I see food freedom a lot online, but, moving away from just this, calorie and macros and micros to adopting healthier behaviors in the long term.
Mm-hmm. And I always think about, the whole calories thing. Obviously, there's a role for that in some circumstances, but I always think about some of the lifestyle changes that could probably make a bigger impact on people, like, going to bed at a reasonable time and getting movement in during the day and that kind of thing. And a lot of times it really is the more simple stuff that gets overlooked because we want to make it more complicated or fancier, or, do the more shiny type of stuff.
Exactly.
So what are some of the challenges that you see in the personalized nutrition industry?
Well, the challenge is that at the moment it's not regulated. Yeah, it's a very poorly regulated industry. And so as a consultant now, my job a lot of the time is making sure that companies are making sure that they're playing by the rules. So let's say you can't make medical nutrition claims, for example, or use some blogger as a key scientific point of reference. And so a lot of it is looking at how can we make sure that what we are saying or what we are doing is grounded in the evidence base. So if we say that it can help with behavior change, we need to back that up with information and whether it's with a clinical trial or with the scientific evidence that's already available, or making sure that we access the experts in the industry that have that expertise so we can build that into new products, for example. So regulation is definitely a problem. And also the reason is because the technology has moved so rapidly that regulators haven't been able to keep up. And then we have on the healthcare professional side, because they have not adopted technology, they can't, criticize them or challenge the technologies that are being developed because they can't interrogate the algorithms, for example. And so we have this rapid evolution of an industry that doesn't have adequate oversight. And so that's, I would say, one of the main challenges. One of the other things is that in terms of the ethics is one of the other issues, because of course, when we are looking at using big data sources and interrogating them with machine learning or AI, we are using these databases that have been existing for a while, or where research has been done in a particular population group. But if the algorithm then keeps on spitting out, well, you should have kale smoothies for breakfast, that is not relevant to many people. Yeah. And so is the technology relevant? Is it representative? Did it include, a variety of or diverse data sets? That is really where the challenge comes in. And so the ethical implications of newer technology is definitely something that is increasing now. But again, we have, governance frameworks, we have kind of guidance, but we don't have any regulation that says, well, you have to be completely transparent about which, databases you use, or how did you get to that recommendation? And that's definitely one of the ethical challenges that we have. And then the other one is, what I found also was that practitioners a lot of the time have a risk perception of technology. So I think, well, dealing with genetics, it's too risky, and therefore, I'm not going to deal with it, and it might, ruin my reputation, or, and so there's this risk perception, even though there's a clear delineation between lifestyle and medical, there's that lack of knowledge. And so if we are not adopting or embracing and understanding, we cannot challenge. Yeah, we cannot ask the right questions at the right time. And so that's a different challenge. So we definitely need to look at the education of healthcare professionals, and that's just not nutrition, it's, across the board, and raising the level of digital literacy across the board so we can work alongside the technology and not, as I said, against it. And then, of course, the other thing also is that, like you say, we think about our training as nutrition, as a box. But then we need to consider, okay, well, what is the societal impact of this technology? Will it increase inequality, for example? Are we worsening access to credible information by making this a paid app, for example, rather than a free app? And so those kind of challenges, we need to understand not only, the societal impact, we need to understand what's happening in regulation, we need to understand what's happening in technology. And so just knowing your nutrition side is not enough. You need to have the wide impact in terms of what's happening in consumer behavior and why do they prefer digital. I was reading this excellent book on communication. So communication in a digital age where the newer generation, they don't want to speak on the phone, they don't want to have a video call. And so how do we adapt our practice, which is different from what we've learned? How do we take a very good detailed diet history if somebody doesn't want to talk to you or actually see you face to face? They prefer to do it by email or text. And so this whole concept of understanding, how do I adjust what I've done? The basis is great, the training is great, but we are entering the fourth industrial revolution, and that's how we need to adjust. And it's not up to the training, it's up to ourselves to keep up, to learn, to adopt new CPD training or access experts and, do podcasts. That's how we access and evolve the nutrition practice, because essentially that is the direction where it's going. There will always be a group of those who want it in the traditional way, but the way that healthcare is going, nutrition is forming part of the precision healthcare movement. And that's what we need to remember. We are not in isolation. We are part of something much bigger that is happening around the world.
Mm-hmm. And I wonder how this experience this year with COVID is going to affect people's desire to, interact in a more traditional way. I mean, I hope we'll still want to see each other and that kind of thing, but I can definitely empathize that sometimes I'd rather set up my appointment on a website rather than have to call someone. And I always think, I bet the younger generations are probably even more on that side of the equation than some of the older generations.
Yeah. And we have to keep that in mind, I think. Like you said, there are a lot of people with, chronic conditions. And so we can't just have everything online, but we need to understand, still remain consumer-centric or patient-centric or client-centric and say, okay, where is this individual on, different scales, and what is the best way to deliver what I have to offer to this particular person?
So what would you say needs to happen in order for personalized nutrition to become mainstream for not only the public in general, but also practitioners?
Yeah, I think one of the main things is that we need to make access to nutrition experts a lot easier. And I know that, we have a lot of competition, in the marketplace at the moment. So having access to a credible, credentialed practitioner is incredibly important. So people don't have to pay out of pocket when they are healthy and actually are looking for information. We only reimburse when people are sick, so to speak. So having prevention being reimbursed and having that available as kind of a national health, program, people should have access to that. And I think that is one of the big things that is happening. And I saw this week just that, there's a big focus on, getting nutrition into the education of medical doctors, for example. And yes, I do think that's important, but I do think there are a lot of nutrition experts, highly qualified, studied for years to get this and have a lot of experience. And they need better support in terms of, how can people access them, having the referral set up, and then having the reimbursement set up so that it's easy for people. At a click of a button, you can get, a doctor to discuss your problems. But, how can you make it as easy to make, healthy, easy choice to get people to access preventative information? And I think that is going to be really important. And the other thing is, I think in terms of the technology that we have now, it's going through evolution, and people are kind of trying to find what is the best approach, which is data-driven. So we need to make sure that, nutrition experts have a really important role to play on the management side of these teams, development teams, to make sure that the information is actionable, that it doesn't spit out just a list of things, but actually it's grounded in the reality, in the real world setting of individuals, so that, people can actually implement those changes. And I think behavior change techniques, the incorporation of those is going to be critical. Because like you say, nutrition is great, but the behavior change incorporation for diet and lifestyle is critical. So we need to make sure that they are incorporated into that. And then finally, I think, as practitioners and also for the public, we need to have an understanding or a level of digital literacy so that we can question and make sure that, healthcare and credible information is accessible to all. And so we need to make sure that, solutions that are available need to be grounded in the evidence base and that they have an impact on health or behavior as well. And I think that's what really needs to happen.
Mm-hmm. Yeah, I'm just kind of laughing about when you're saying that doctors need more nutrition education. I'm like, yes. And doctors already have a lot going on. They barely have enough time to spend with the patient as it is. So I think it would be really awesome if more dietitians were employed at doctors' offices. And like you said, that preventative piece was reimbursed just as much as the, fixing when it's already broken kind of piece. Because that's where I feel like, unfortunately, the healthcare system in this country, because everything needs a diagnosis code, and it has to be that they've already gotten ill in some way to even, qualify for nutrition care. It would be really awesome if more of that preventative reimbursement existed. And then also that at least doctors knew the value of the nutrition piece, so that even if they don't have time to do it themselves, or, again, I don't think doctors are really the ones that should be doing it. In most cases, they at least know, hey, this patient could really benefit from talking with a dietitian. Hey, we have a dietitian on staff. You could go right down the hall and meet with them, and it gets covered. And I think that would be a really great move for just insurance reimbursement in this country. Absolutely.
And I think also that this is a great opportunity for kind of these public, private partnerships to make that happen. Because, the tech companies can move fast. That's the one thing. They can move fast. They can have, spit out the data and say, this kind of person, would fit better with, this kind of a program or this kind of a solution. But it needs to be reimbursed. So the foundation needs to be correct. And the time that we are now is perfect, because consumers are now aware that nutrition is important and nutrition equals my health. And therefore, public-private partnerships, I think, is the way to go. But basing everything foundationally on you need a code, that is certainly something that we need to change.
Mm-hmm. Well, it's been really awesome to talk to you about this because, like I said, being an entrepreneur myself, I'm always looking for ways to improve the work that I do with my clients and to be able to translate what I do one-on-one with clients, whether that's my nutrition clients or my business coaching clients, being able to translate that into something that's scalable is always something I'm very interested in. So it's really cool to see that your business, Kina, is doing that for nutrition professionals and, just the industry in general. So I know that you have a free resource that you can share with listeners. And I think you mentioned before we started recording that this would be more of a resource for nutrition professionals.
Yes. So what I have for the listeners of the podcast is I've created a free download, which you can find on my website at mariettaabrams.com/digital nutrition academy. And it really is a 5-step guide to adopting a digital nutrition mindset or practice. And so it gives kind of the 5 top level strategies that I would say you need to have in place to increase your income and scale your knowledge and your service and your expertise in order to serve more clients and have more impact enabled by technology.
Awesome. And then is there anywhere else that people should look for you? We'll make sure that we link to this in the show notes. If you all want to go check this out at lauraschoenfeldrd.com, we'll make sure that Mariette's links are there. Is there any other places that people can learn more about the work that you do or follow you? Where should they be looking?
Yes, so I am on Instagram or at Mariette_Abrahams, on Twitter at Mariette Abraham, not with an S at the end. And I'm very active on LinkedIn as well. And of course, people can learn more about me on my website at mariettaabrams.com as well.
Awesome. Well, thank you so much for sharing your time and your expertise with us. And like I said, I think it is something that people are starting to get more aware of, and hopefully more dietitians and nutrition professionals are starting to embrace as our businesses either are already online or kind of getting forced online or forced to start using this technology rather than being afraid of it or, resistant to it or thinking it's some kind of scam or something like that. Just realizing that there is a lot of data and research to support the value of using technology in a way that's actually positively influencing people's health instead of negatively.
Correct. Thank you so much. Thank you for having me.
Yeah, it was my pleasure. Well, thank you. And thanks to all of you for spending the last hour with us on the Fed and Fearless podcast. We will see you here next time and we'll talk to you then. Bye, everyone. Hey, everyone. Laura Schoenfeld here again. As you know, I absolutely love working with women from all walks of life to help them create a purpose-filled life that they love. And over the past 2 years, I've expanded my mission to help nutrition business owners drop the hustle and come into alignment with their ideal business goals so they can work from a sense of ease and abundance and grow their income and their impact with joy. Unlike other business coaches, I have experience in the integrative and functional medicine, health, and wellness industry. And I've heavily invested in my own online business training and mentorship to get to a place where I'm now bringing in multiple 6 figures of revenue on an annual basis. Would you believe that I've invested over $130,000 in my own business development and mentorship over the past 7+ years? And honestly, that's just the financial cost of growing my business. It's taken me hours and hours of testing, learning, experimenting, and lots of failing to get to the place where I am today. After all this, I can tell you one thing with absolute certainty. There's no way I would be where I am today if I had not been willing to invest in my growth and to find the incredible mentors who have helped me accelerate my business faster than I ever imagined. The truth is that running an online business can be incredibly isolating. And if you don't have the right strategy or systems in place, it can take up nearly every waking minute of your free time, which is a recipe for a major health disaster and some serious business burnout. To grow your business to 6 figures and beyond without destroying your physical and mental health, you need support from both a mentor and a community of people who know what it's like to run a nutrition business online, who can help you succeed faster and easier than you'd be able to on your own. And that's why I'm so excited to offer a space for you to experience joyful and profitable business growth while being surrounded and supported by other driven nutritionists on the same thrilling journey of entrepreneurship. This opportunity is my annual mastermind. In the mastermind, you'll create relationships that will last a lifetime and achieve results in your business that you never would have imagined for yourself. If you want to learn more about this mastermind opportunity, go to lauraschoenfeld.com/mastermind. On that page, you'll find everything you need to know about what the mastermind includes and how to apply for your spot. I'd love to connect with you further about the business that you're growing and how the mastermind can help you support your goals. So go to lauraschoenfeld.com/mastermind to send in your application, and I look forward to chatting with you soon.